Hi, my name's Cecilia Devine, and I'm a senior in high school, looking to major in psychology to eventually become a teen and child therapist. I'm terrified of public speaking, but one thing that's very, very important to me is mental health. Um, so I wanted to start a channel to, talk about it, destigmatize it, process it, um, start, more of like an open, honest forum, an open, honest dialogue about it. So on this channel, I was hoping to, you know, maybe give advice, talk about my personal experience, give people tips, activities, coping mechanisms, resources, websites, self help ideas, things like that. Me personally, I've been in therapy since I was 11, so around 7 years. I've had 5 different therapists. I've had 3 psychologists, psychiatrists. I've been hospitalized and inpatient in a mental hospital 2 times, a year and a half apart. I just got out of Fort Wayne Saratoga Hospital in December. So, yeah, I've been struggling with mental health since I was 6 years old. That's when I got my first diagnosis with the generalized anxiety disorder. Um, so, I have a script and a list here, which I'm going to be reading off of because I'm not prepared and nervous. Yeah, again, I have anxiety disorder, so, you know, this is coping for me, I guess, or bringing myself out of my comfort zone. So, there's a tip right off. Do things that make you uncomfortable. Help your anxiety. So, topics I'll be talking about: depression, specifically major depressive disorder. I'll be talking about how to explain it to friends and family, how to intervene in the beginning stages of a depressive episode, how to deal with triggers to your depression. I'll be talking about anxiety, how to lessen and handle an anxiety attack, how to tell your friends about your anxiety, how to prevent rather than intervene during an anxiety attack. So, that'd be things like breathing techniques or some stuff like that. Depersonalization and dissociation. I'd start by defining it because that's one of the areas of mental health that doesn't get a lot of attention, and it's often confused for schizophrenic tendencies and things like that. And with that, I'll go into, in terms of helping, grounding techniques and stuff like that. Anorexia and other eating disorders. I'll be talking about body dysmorphia, how to tell people about your eating disorder, how to prevent relapse into bad habits, which would include obsessive weighing, calorie counting, stuff like that, pinching, checking. I'll be talking about PTSD and CPTSD, which is complex post-traumatic stress disorder. I'll be talking about lifelong effects of childhood trauma, growing up in an abusive household, and ways to deal with it. So that would include child abuse, sexual abuse, emotional abuse, domestic abuse, physical abuse, violence. Also dealing with triggers and flashbacks, emotional flashbacks. I'll go into what that is. The difference between PTSD and CPTSD. CPTSD is what I have. Dermatillomania and other BFRBs, which stands for body focused repetitive behavior. So picking your skin, pulling your hair, biting your nails, things like that. I'll be talking about what they are, tools, resources, how to help lessen your BFRB. I've been in and helped with a BFRB support group for a few years now, and I've also been to the BFRB conference in San Francisco. So that was very helpful. I have a lot of resources from that I can share. And then in terms of trauma, I'll be talking about hypersexuality, which is one end of the sexuality spectrum when it comes to trauma, and also sex repulsion, which is the opposite end of the spectrum. Hypersexuality is when you have an excessive desire to have sex and an excessive drive, and sex repulsion is when you're repulsed by sex, disgusted by sex, don't want to have sex. Or if you do, you feel as though you can't or you're scared of it, causes you anxiety, things like that. I'll also be talking about emotional incest, which does not get a lot of light in regular mental health circles. I'll be talking about what it is and how to set boundaries, because boundaries are the biggest and most important aspect of emotional incest when people are going through it. I'll also be talking about self-harm and suicidality, which is an intense topic, but I'll be talking about how to combat self-harm urges, healing techniques for your scars, the difference between self-harm and BFRBs, how to have a good experience if you have to go to inpatient or be hospitalized, give you resources, how to tell someone that you're suicidal, work on a suicide prevention plan, what that would look like, how you can do it yourself, and then also go over the difference between active and passive suicidality, because that's a difference I find a lot of clinicians even confuse. the difference between being actively suicidal and planning and, setting a date, and then being passively suicidal, just wishing something would happen to end your life, but not actively going about doing something to end it. I'll be talking a lot about treatment because I'm very treatment forward, or very treatment focused. I think being treatment focused is very important. I'll be specifically talking about hospitalization and cognitive behavioral therapy, or CBT, but in terms of trauma, I'll also be talking about EMDR, which is an rapid eye movement type of therapy. I'll also be talking about emetophobia, which is the fear of throwing up, and other phobias, as well as what makes something a phobia, rather than just a fear. I'll be talking a lot about stigmas and stereotypes, and relapse prevention, and how to make a prevention plan, because a lot of therapists, or at least in my experience, don't go over that. So that's a lot of topics, and a lot of them will be intertwined, especially the ones that are relating to trauma. But yeah, I hope that you keep watching, and I hope that I can help someone. That's really why I'm doing this. I'm not out here to be like Logan Paul or anything, but I do want to be a therapist, and I do want to help people in any way I can. I also make a lot of mental health focused art and writing. I'll leave links to that stuff below if you want to check that out instead, because obviously I'm not great at this so far. But yeah, I don't know, I just want to help people. Subscribe, like this, and I hope to see you again if my confidence can handle making another video. Thank you for watching, and subscribe. And if you're having a bad day, I hope you feel better, and I hope you can take the steps that you need to get yourself help, whatever those may be.